Good evening, and thank you so much for joining us on this evening's community leader call on the district's response and recovery efforts related to coronavirus. My name is Tomas Talmonte, and I'm Deputy Chief of Staff to Mayor Muriel Bowser. This evening, you'll be hearing from our director from the D.C. Department of Health, Dr. LaQuandra Nesbitt, as well as our director for the Department of Homeland Security and Emergency Management, Christopher Rodriguez. Again, if you have any questions related to our efforts or looking for information, resources, coronavirus.dc.gov is the best place to go. We also have information related to testing, recovery, information for individuals and for businesses and organizations. So that is your one-stop source for all information. So as we get started again, I want to remind everybody that if you have a question, you can press 0 to get entered into our question queue. And we will now hear first from our Director of the D.C. Department of Health, Dr. Nesbitt. Dr. Nesbitt?
Thank you so much, Tomas, and thank you to everyone for joining us this evening at this critical time in our community as we continue to work together to respond to the coronavirus pandemic, flatten the curve, and save lives. Right now, we need 3 things as a community for everyone in our community to be focused on. We want all of you to stay home except for when you are engaged in essential activities, and this is everyone's individual responsibility. Social distancing when you do leave home, and then calling a healthcare provider if you become ill. This morning, we reported 229 new cases of COVID-19, bringing our total cases to 1,440. And tragically, we also announced that five new deaths, bringing to date 27 D.C. residents who have passed away due to COVID-19. Testing remains a critical part of our COVID-19 response, and on Friday, we launched a COVID-19 testing site at United Medical Center in Ward 8, and we want you all to join us in encouraging residents in the priority testing group to call for an appointment if they are experiencing symptoms of COVID-19 or otherwise feeling ill. And residents can call the hotline at 855-363-0333 to get an appointment. The United Medical Center testing site is also available to residents whose physicians have given them an order for testing for COVID-19, and they can call that same number to schedule a time for them to receive their COVID-19 testing at the United Medical Center testing site, which is open Monday, Wednesday, and Friday. We're also encouraging members of our community who are Spanish speakers to call 844-796-2797. Again, 844-796-2797 to receive assistance and support. While we are fighting the virus, we are also preparing for the district's recovery from this pandemic, and we will provide you some additional information on the legislation that was passed yesterday by Council, the COVID-19 Emergency Supplemental Legislation, which will provide additional supports for our workers, renters, homeowners, local businesses, and students. We've also created the District Economic Recovery Team to proactively plan, strategize, and coordinate how we will eventually restart business activities, support our workforce, and bring prosperity back to the district. So we look forward to continuing to work with you all. We're going to have Tomas provide us some more information about the content of the legislation, and then we'll be available here with Director Rodriguez from the Homeland Security and Emergency Management Agency to take your questions.
Thank you, Dr. Nesbitt. And again, so the council passed legislation yesterday that has many important provisions that we want to bring to your attention. One is it authorizes the mayor or extends the emergency and public health emergency and emergency executive orders for an additional 45-day period, total of 90 days from the first declaration, which is June 8th. It authorizes the mayor to issue $25 million in grants to district nonprofit and for-profit hospitals for supplies, equipment, and personnel costs to address the impacts related to COVID-19. And allows youth who are aging out of foster care to choose to remain in the district's care during the declared emergency. creates an emergency paid leave program to cover employees at companies with 50-499 employees who are not covered under the Federal Families First Act, makes amendments to the district's unemployment insurance paid leave programs to conform with the Federal CARES Act, which we did have a full briefing from our director for DOES, Unique Morris Hughes, this morning at the Mayor's press conference, which is available the materials from that are available at coronavirus.dc.gov, and the video is also available on our the Mayor's social media platforms as well as on the web page as well, coronavirus.dc.gov, so if more information related to that. As we discussed, there's provisions that prohibits rent increases for all residential properties during the emergency and for 30 days thereafter. Requires mortgage companies to offer a 90-day deferment program and permanently waives any late or processing fees during the emergency and prohibits reporting any delinquency to a credit bureau. Related to consumer protection, expands utility shutoff moratorium to cable and telecom services, double fines on businesses for deceptive, unfair, or unlawful trade practices, and prohibits debt collection activity during the public health emergency. It increases CBE requirement to 50% on all contracts that are not related to the COVID-19 emergency, authorizes advance payments where needed to CBE contractors, and ensures that small businesses will not be taxed on SBA loans received under the Federal CARES Act. As we all know, the district was classified as a territory in the Phase 3 bill of the Federal CARES Act. The mayor has been in contact with not only the White House, but with our regional delegation, congressional leadership, to ensure that we are made whole in the Phase 4 bill of the CARES Act and continues to so that we get comparable coronavirus relief funds to the other states. One other thing that I wanted to draw to attention before we go to Director Rodriguez is we have many financial resources available to individuals, as we stated, through DOES and unemployment programs, but we also, there are residents may be eligible for food, cash, or medical assistance through the D.C. Department of Human Services, through SNAP, that's the Supplemental Nutrition Assistance Program, temporary assistance for needy families, also known as TANF, and the Medicaid or Alliance programs. To make the application process for these programs easier, DHS launched a new application at dhs.dc.gov. New and returning users can apply for one or more of these programs simply by clicking on Apply for Benefits and filling out the combined application. Additionally, residents who recently lost their employer health care coverage or are currently uninsured can enroll during our special enrollment period through the DC Health Exchange. So you can do that right now through DC Health Link at dchealthlink.com. So you can do that completely online. Additionally, completed applications can be found for DHS services can be completed electronically, mailed, faxed, or dropped off at a DHS service center to help enforce social distancing. We're ensuring that DHS service centers are only open for picking up and dropping off applications and documents. As we have a lot of our ANC and Civic Association leaders, I want to make sure you all have some numbers to give out for residents that may need assistance. So residents who need assistance or want an application mailed to them can call the DHS call center number. That is 202-727-5355. Again, that is 202-727-5355. We also have another, some just follow-up announcements related to that. Customers who are currently receiving SNAP, TANF, Medicaid Alliance, or other public benefit provided by DHS do not need to take any action at this time to continue receiving benefits that would otherwise expire. Those benefits will be automatically extended. And we're also working to get existing SNAP recipients more money to purchase groceries. The district was approved to provide SNAP households that are not currently receiving the maximum SNAP allotment with a temporary increase in both March and April. These additional benefits will be automatically added to EBT cards, and no action is required from households receiving SNAP. The payment for each household will vary because it depends on the household size and the monthly allotment currently received. And then we also wanted to draw attention to access to emergency shelters. They are remaining open through this public health emergency. We want to, the mayor said earlier, but we really want to emphasize our thanks to providers who continue to run these facilities and support the residents who are staying in them. If you or know residents that are without safe housing, please call the shelter hotline at 202-399-7093, and I'll repeat that number for the shelter hotline. That is 202-399-7093. We ensure that phone is answered 24 hours a day, 7 days a week. And so now I will pass it to our director, Rodriguez, to give the update from Hcma. So, Director?
Thank you very much, Tomas. Thank you, Dr. Nesbitt. Just wanted to say good evening to everyone. Hcma and our staff remained here at the Emergency Operations Center located at the D.C. Department of Health. We have at least a dozen agencies here, including federal agencies from FEMA, from the U.S. Army Corps of Engineers, and of course our D.C. National Guard. We have been working very closely with D.C. Health to begin planning and implementing some of our medical surge planning and programmatic initiatives. We also continue to work hand in hand with FEMA in particular on looking at some of our costs for this incident, and of course working with the mayor's office and the city administrator's office on cost recovery. So you have many of your fellow residents are here at the EOC working hard day and night to make sure that the district's response and recovery efforts are being executed and well underway as we go through this incident. So that's the update from Hcma, and I'll turn it back to Tomas.
Thank you, Director. So again, and I just want to reiterate our testing. I know we have a lot of questions that we're getting on testing. So we do have all of the information related to our testing at coronavirus.dc.gov. But for those priority groups that may be symptomatic and are wanting to get tested, first they should contact their doctor or medical provider, but we also have a hotline in English available that is at 855-363-0333. Again, that is 855-363-0333. And then we also have a hotline that's in English and in Spanish, and that number is 844-796-2797. Again, that is 844-796-2797. Both numbers are available on the front page of our coronavirus website. So if you didn't, if I was talking too fast, you can go there to get the numbers and share those with residents, and if you need them yourself. So now we're going to go to questions. I want to remind everyone to please press 0 if you have a question, and you'll be added into the queue. And so we'll go first to Brenda Richardson in Ward 8. Brenda, your line is unmuted.
Hi, thank you for this opportunity and for the great jobs you're doing. Dr. Nesbitt, we've got a problem with folks in our community not practicing social distancing, and there can be 20 to 30 people outside at a time. So in light of the fact that this community is very vulnerable as it relates to the health disparities that they're talking about for African Americans, how vulnerable are we to getting infected with having that many people hanging out in our neighborhood?
So thank you so much for the question, Ms. Richardson. It's always great to hear from you. I recognize that you all have been having a challenge, and it's something we've been in contact with MPD about. I know you've been in contact with MPD about it, and that you've been getting a speedy resolution when you've been reaching out to them. The mayor has been, again, working very closely and communicating the expectations to MPD around what it is that we expect for our community to be staying at home and social distancing, and for individuals to not be doing group activity in our open spaces and play spaces. And so that's exactly what we've been focused on for the past week, is making sure that we are using our resources, our law enforcement resources, not just MPD, but all of the law enforcement resources that we have, to discourage people from congregating in the open spaces, to move them along, but still ensuring that people can get the recreational activities that they need to do, but doing it safely with families. So we do appreciate people like you, and you in particular, bringing these issues to our attention when they occur. We want to make sure our residents do feel safe in their neighborhoods when they are out getting the recreational activities they need to with their families, and we are going to be focused on making sure that people are adhering to the social distance recommendations, because that's what's going to help us flatten the curve.
Thank you, Dr. Nesbitt. We'll go to our next question. Hcma Varsi. Hcma Varsi, your line is unmuted.
Hi, thank you. I have two quick questions. One, I was wondering if our numbers would be accurate in terms of getting information from health centers that are telling people to stay home and not get tested when they are quite sure that they have COVID-19. They have all the symptoms, but they're being told that they don't have vulnerability, so they can't go get tested. So I'm guessing that would increase our numbers twofold, and wondered if they would be included in our count. And then I also wondered if the mayor would mandate people wearing face covers, especially when walking into stores or on the bus, just to keep our essential workers healthy. Thanks.
So I think I understood your first question. I'm not quite sure I did completely, but I'll answer it. So we do know that there is the potential for pre-symptomatic and asymptomatic transmission, and because of that, there is an assumption that the laboratory-confirmed number of cases may be an underestimate of the amount of true infections in a community. That doesn't just happen in the District of Columbia. That happens everywhere. However, given the challenges that occur with testing supplies, et cetera, we have not transitioned in our community to move away from our priority groups for testing into testing asymptomatic individuals, because we know having people stay at home and only going out for essential activities can decrease the risk of spread to individuals. The reason why we focus on testing those priority groups is because we know that testing and diagnosing in them can actually change their clinical management and changing their public health management. Testing asymptomatic or pre-symptomatic individuals does not change what we are going to be asking them to do, which is stay at home and only go out for essential activities. Whereas testing and diagnosing in individuals who have underlying conditions, are elderly, may actually help us to change how they would be managed clinically, getting them the supportive therapies that they may need, and otherwise change the trajectory of their illness. As it relates to a recommendation for face coverings and masks for people in the general public, we have published that guidelines and that guidance. It went out on our website over the weekend, and we have made recommendations consistent with the CDC recommendations, which is that we still prioritize social distancing, which is asking people to stay home, only go out for those essential activities, and we have made clarifications around people wearing face coverings when they cannot safely practice social distancing. And some of the things that you mentioned in your question would be appropriate for that. So if you're out at the grocery store where you may not be able to safely social distance, or if you're going to places like pharmacies and other crowded spaces on public transportation and ride share, et cetera, wearing a face covering would be appropriate. We do ask that members of the general public not purchase or consume medical masks like the surgical mask and the N95 respirators, and that they use other forms of face coverings such as the cloth or face coverings that can be purchased, or even homemade masks.
Thank you, Dr. Nesbitt. We do have in our resource page as well on the coronavirus site guidance from DC Health on how to wear those cloth masks that are, again, not the medical mask, but the bandana or other cloth material that can serve as a mask. We do have that guidance on the proper ways to use, to wash after use, et cetera, as Dr. Nesbitt highlighted, on the coronavirus website under resources. So if you're looking for that, it is on the page. We'll go next to Karen Kwok, and I hope I'm not mispronouncing that, but Karen, you are unmuted.
Hi, this is Karen Kwok, and I am an appointee for the Mayor's Commission on Asian Pacific Islander Affairs, and I want to appreciate all of you there for your tireless efforts on advocacy for the community's needs. And mine is just actually an announcement. I'm really proud that our commission, in conjunction with the Department of Behavioral Health and with the support of the Mayor's office, will be sponsoring a mental health wellness workshop on April 10th, Friday at 6 p.m. to 7:30 p.m. And you can find this event listed on the Mayor's office on Asian Pacific Islander Affairs. And this is in support of wellness overall during this chaotic time. Thank you again for all of your efforts. Stay healthy and well, everyone.
Thank you, Karen, for highlighting this important workshop that's coming up. And for all those on the line, so Karen pointed where you can find it on the Moapia website, but also you can go directly to sign up and register at dc-covid19-mentalhealth.eventbrite.com. Again, that is dc-covid19-mentalhealth.eventbrite.com. You can get more information, register to participate in the event. That'll be this Friday, again, this Friday from 6 p.m. to 7:30 p.m. And then also, if you're looking to, we know this is a tough time for everyone, and thinking particular of our senior population. And so, as the mayor said, one thing we need to be doing is we'll get through this together, and we're in this together. So checking on your elderly neighbors and giving them a ring, checking in on them. But if you need someone to talk to, we do have a 24/7 hotline through the Department of Behavioral Health, and that is 1-888-793-4357. So again, that Department of Behavioral Health hotline is 1-888-793-4357. We also have that resource available on the coronavirus.dc.gov website. So thank you for that. We have time for just a few more questions, and so we're going to go next to Samantha Brew in Ward 4. Samantha, your line is unmuted.
Hi, good afternoon. I just wanted to say first, thank you all for the wonderful work that you're doing to help quell the outbreak in our communities. My question was more so about the communications being done to help raise awareness about the outbreak. I just wanted to know what resources are available to residents to help them better understand the seriousness of the outbreak, and also what are some ways that residents can get involved in increasing communications about the outbreak?
Thank you for that great question, because as we know, we all have a role to play in flattening the curve by first staying home, but also while you're home, you can, through your own social media platforms or through your email list, or share resources and information to help us get the message out there for how to flatten the curve, how to let people know about testing, symptoms, all of that. We designed the coronavirus.dc.gov to be your one-stop shop to get all of that information, where you can get social media graphics and flyers related to flattening the curve, to symptoms, to proper, as we talked about, proper cloth mask wearing. We have all that information. So under the resources tab is where we have that for individuals, for businesses, and organizations, where you can get that information. It's in multiple languages as well. So I know a lot of we have commissioners or civic community group leaders that have different constituencies that you're engaging with. So we have those available in multiple languages for you to share as well. And we also, the website is fully translatable into multiple languages, the complete website as well. So that is a great way for, if you're home, to share information through your social media, when you're home, to share information through your social media platforms. We also have a daily press briefing that's usually at 11 a.m. every Monday through Friday, sometimes a little bit earlier, which is live stream on the mayor's Facebook and Twitter, but as well as Channel 16, that's DCN Channel 16. So we're providing up-to-date information every day through those platforms. So be on the lookout for, if you're looking to get updates and more information and resources, they'll be on the website following the press conference. But if you want to watch along with us every morning, we usually have the press conference at 11 a.m. Or a little bit earlier. So thank you for that great question. All right, we'll take one more question. Can we go to, we're going to go to Kim Bender. Kim Bender, your line is unmuted.
Hi, I'm Kim Bender, the Executive Director of the Heinrich House Museum in DuPont Circle. And my question is a little outside the box, I think. I was diagnosed with COVID kind of early, and I've been self-isolating and was just released by the Department of Health, cleared to leave my apartment. And I'm wondering, I'm assuming as more and more testing is done, there will be more and more people cleared. Is there a way that we can be helpful to the city? That's my question.
We'll go to Dr. Nesbitt for this one.
Hi, so thank you. Yes, so far there are 360 more of you, because we've cleared 361 individuals from isolation to date. Our recommendation so far is that we still want you to be a good role model and to stay home and social distance. And the reason why we're suggesting that is that people model the behaviors of others. And so as we have 1,400 individuals who've been diagnosed and they're being cleared from isolation, as the number of individuals who are cleared from isolation increases, people will wonder and speculate why there are more and more people out in community and not be able to understand or distinguish why there are certain people out in community who have a perception of, I've been cleared, I've already had it, I have a level of immunity, and the science around reinfection is not completely clear. So we're still waiting to learn a lot more about that. Typically we have this belief that once you've had something, you can't be reinfected, and that may be true for COVID-19, but we're still waiting on the science to confirm that. And so what we recommend is for people who have been cleared from isolation and people who have been cleared from quarantine is to still model that good behavior of social distancing and staying home.
Thank you, Dr. Nesbitt. Well, thank you, everyone, for joining us on this evening's call. And I want to remind everyone that we have these calls weekly, Wednesdays at 5 o'clock. So we encourage you to share the word on that. That is one thing you can do is help get the word out on this call and share the RSVP information so that your friends, family, and neighbors can join us and get the most up-to-date information on our response and recovery efforts every week at 5. And again, to point to our website, coronavirus.dc.gov. Last night, I want to close out on a positive note. Last night, we all came together as a city to applaud our healthcare workers, including the mayor leading us on a clap throughout the city. I saw some beautiful videos of the whole city coming together to thank our healthcare workers, our first responders, those that are working at the grocery stores to make sure that we have food. So everyone that is working hard every day, our healthcare workers to save lives, we just want to extend a very big thank you. And then a big thank you to everyone on this line. You are our community leaders, ANCs. your residents that are sharing information, sharing ways that people can know the symptoms, helping us spread the word to stay home so that we can flatten this curve, and we all have a very important role to play in flattening the curve. We will get through this together because we're in this together. And so a big thank you on behalf of the mayor to everyone on the line for being on with us tonight, and we'll talk to you soon. Thank you.